It's so amazing to have you here. I want to talk about your background in dentistry and kind of how it started and how it's evolved into what it is today and why oral care is so important to you.
Yes, thank you. Thank you for having me, ladies. I'm a huge fan of your work, so this is super fun. I started out as every dentist does. I was traditionally trained. I went to Tufts in Boston. I'm from New England. Um, and I always felt something was off in dental school, but I was just head down plowing through because it is an overwhelming amount of work and commitment. But it just never resonated with me how we were treating patients. The whole concept of more end stage disease, putting out fires, fixing things that are broken, but not as much time working up a patient, health coaching, getting to their true story to help unpack that and get them to true optimization and health. So I went through dental school, I graduated, I worked as an associate, and I was quite miserable, to be honest with you. I thought I was going to leave dentistry. And I almost did. And I thought, how do I salvage this career? How do I get more upstream? And to me, that was with children. So I thought, well, if I can educate parents and motivate kids to not end up in this situation, that's how I can course correct this path. And so that's what I did. So I went back and I went through my pediatric residency, became board certified in that, and graduated. And no shocker, was still finding the same thing, but now it was with kids. It was a churn and burn. Now you see more patients. It's like a mill. Kids are undergoing anesthesia, and you're still not getting to the why. And so it has been a journey and an evolution. But I started connecting with thought leaders, I would say, in dentistry, people that are thinking a bit outside the box. I went and sought out additional trainings in laser dentistry and biomimetic dentistry and airway and oral microbiome, et cetera. I received a couple other certifications in integrative and naturopathic dentistry. And then I wanted to take it one step further to really connect the dots. And I went to the Institute for Functional Medicine and got my certification there. And so it's been an evolution, and it still is evolving. And I ended up opening my own practice 10 years ago, and it's what I believe to be the first functional pediatric dental practice in the world. And we're expanding, and people travel from very far to seek the care that we're offering, simply because we are trying to get to the why. It's really that simple, and really work upstream with families. And my career's been salvaged. I'm so much happier because my patients are getting well. I see change. And that's the bummer with dentistry, is there's what we call repeat offenders. And it's because we're never really helping that patient understand what went wrong with their oral health. And now we're learning about the oral systemic connection and how important oral health is to every other system in the body. And so this is a passion project of mine to spread this message and to help not only motivate patients to demand this, but to help train dentists to think differently and practice differently too.
Well, I have a million questions just listening to you. I'm sure someone who's listening and they're like, okay, it seems like oral health is important, but like, why should I care? Like, no one really thinks about their teeth. They don't realize the impact it can have. So in like a high level, we'll get into more of the details. Like, why should someone even care to listen in on this conversation?
Totally. And I think the reason this has happened, like much of medicine, is that we compartmentalize now, right? There's specialties for everything. Your eyes are separate, your mouth, even insurance separates it. And so unfortunately, over the many, many decades, now patients in the public feel this way too. And the mouth gets an afterthought. And we've normalized dental disease. We've normalized cavities and gum disease and bad breath and tonsil stones and all of these things, but common isn't normal. So what's important to know, I think most of us now are very familiar with the gut microbiome and how critical gut health is to every organ system in our overall health. Well, we now know also that oral health is not far behind, and they're very bidirectional. The oral microbiome is the second most diverse microbiome in the body. It's the second largest microbiome, and it communicates with the gut. Think about how many times you swallow a day. Okay, so you're swallowing this bacteria. This bacteria also can, if you have gum disease, if your gums bleed, the bacteria can get into your body, into your circulatory system, into your lymphatic system, and wreak havoc on all these other organ systems, the brain, the heart. It can impact fertility. It can impact mood, autoimmune disease, cancers. There's 57 cross-linked systemic diseases now linked back to a dysbiotic or imbalanced oral microbiome. And so it's a slow wave of information to really get people passionate, but I am excited that a lot of people in the health and wellness space and the longevity optimization space are finally talking about oral health, because you can be doing all the things, but if you're ignoring your mouth, that's a huge source of inflammation, infection, and just bad bacteria, to be honest with you. So it's bacterial infections. And so we're really just trying to spread that word. So I appreciate the opportunity to continue to educate your followers and patients on this.
So fascinating, because I was listening to a podcast the other day. It was my brother's podcast, and he asked the cardiologist, or he was a thoracic surgeon. He said, how can someone fast track their way to heart disease or to getting a heart attack? And the first thing the doctor said was, don't brush your teeth and don't floss every day. And I was so, like, I knew that it was on the list, but it was interesting that was the first thing he said. He said, kind of walk me through a day of somebody who would fast track their way to heart disease. And he said they wouldn't brush their teeth every day and they wouldn't floss every day. And I thought that was so interesting. I want to ask you, what are the biggest mistakes that people are making right now when it comes to their oral health?
Not prioritizing it. I just want to make a comment to that. That was a great question by Drew. And, sepsis, bacterial endocarditis, these are big issues. And when I was in my residency, we had to see patients before they went in for heart surgery. We had to make sure their mouth was clean, because these surgeries could fail. Okay. And same with cancer patients. We had to make sure the mouth was checked off and clean. And that means clean of infection. And this was a big deal with COVID too. There was a lot of research out of the UK. A lot of patients had negative outcomes and passed away, not from COVID, but from bacterial infections of the lungs. And when they dug deeper, where did this bacteria come from? A lot of times it came from the mouth. So if you were in the hospital intubated, they're not doing oral hygiene on these intubated patients. And so the bacteria and the biofilm is just building and building, and it can travel into the lungs. So there's a lung microbiome too that can be influenced. First and foremost, it comes to diet. We're not eating properly for optimization. And this, any specialist that comes on your podcast speaking about anything will probably say this. So we are on the go, we eat too much, we're snacking, we're sipping, and we're eating too many ultra processed foods. And not only can those alter the pH and alter the microbiome, but they also feed the bacteria. So sugar and flours and all the preservatives and the food dyes, they're altering the microbiome, and they can lead to disease. And plus, most of them are nutrient deficient. So we are fat soluble vitamin deficient. We're mineral deficient. This impacts how our teeth develop, including in pregnancy and then in young children and beyond. So I think we need to really focus on the basics, which is our diet and hydration and electrolytes and all of those things that we speak of, protein, collagen, and trying to eat more on a schedule and not be so on the go. I think stress too, we know stress will impact cortisol. Cortisol impacts salivary health, how we salivate. And it's our saliva is incredibly important. People don't even think about their saliva, but it is the golden elixir of the body. And if you do not have appropriate saliva, your teeth will decay. You will have gum disease. And this is what we see with cancer patients undergoing chemotherapy and radiation, or as we age, xerostomia and dry mouth. So it's really important to nurture your saliva and make sure it's optimized. And that's with minerals and hydration and electrolytes too. And then, how we breathe is incredibly important. So many of us mouth breathe now. And I think many of us have normalized that too. Like snoring is so common, but it's not normal. you go to an airport or an amusement park, just look around and see how many people not only just have like tech neck, like forward head posture, but their mouths are open. That's drying out the mouth. That's changing the pH. That can lead to oral disease too. And then finally, I get to hygiene. It's really far down the line on for me, but I think many people, they'll do a quick brush, but that's kind of it. It's just a pain. People don't want to spend the time at night to focus on oral hygiene, but it's really incredibly important, and we need to be flossing. And I want people to prioritize it just like they might their sleep now, or their exercise, or their nutrition, like oral hygiene, especially with all the links to all the systemic diseases. It can't be overemphasized. And then especially if you're eating a more American processed diet, it's even more important to have excellent hygiene.
And what would you say would maybe be some of the top signs that your oral health is messed up? Someone's listening, they're like, okay, I'm trying to do all these things, but how is my oral health?
Well, I would say if when you brush and floss, do your gums bleed? When you spit, do you see pink in the sink is what we call it. Those are leaky gums. So we've heard of leaky gut or intestinal permeability. Well, your gums can be permeable too. And our gums it's the first line of defense. Think of you breathe in, you're putting food in your mouth. There are going to be pathogens and pesticides and things like this. There's a lot of immune response in the mouth. And so we need a nice, clean, healthy barrier so that things can't penetrate into our tissues and get into our system. But we've normalized bleeding gums too, but they are not normal. Gums are not supposed to be bleeding. So that's the first thing I would say. Also, I'd say if you go into the dentist and every time you come out, you have a new cavity or you just have a new treatment plan, first and foremost, I'd say get a second opinion, because not every dentist treatment plan is the same, and some are a little more aggressive than others. But if you find that the same is true with your other opinions, then what is going on? You're imbalanced. And usually it's a sign of mineral deficiencies. It's a sign of metabolic disease. It's a sign of insulin, issues with insulin resistance and hormonal imbalances. I mean, it really goes back to all the systemic issues that we find with other organ systems that are failing or not doing well. And then I'd say too, if you have chronic tonsil stones or bad breath. So many people suffer from chronic halitosis. They've normalized it. They grab the Listerine. They have to use Listerine multiple times a day. We say Listerine's a hard no. The research shows that these strong alcohol-based antiseptic mouthwashes, they wipe out healthy bacteria too. And most importantly, they can wipe out the bacteria that influences our nitric oxide levels. And nitric oxide is a molecule very important for immune health and cardiovascular health. And there are studies to show people who are chronic alcohol astringent-based mouthwash users have higher blood pressure and are more likely to have cardiovascular issues too. So if you are finding you have to always have gum or mints or this strong, potent mouthwash, you're ignoring what your body's trying to tell you, the red flag. We love to mask things as humans, right? It's like, I have this headache every day, so I'm going to take an ibuprofen. Why do you have a headache every day? That's not normal. So your chronic bad breath isn't normal. And so it could be an infection in the mouth. You might have periodontal disease. You might have a failing root canal. It could be coming from the gut. It could be a sinus infection. So we really need to unpack that more.
I want to talk about root canals. I want to talk about fluoride. I have so many questions, but I first want to talk about kids' dental health, because that's your background. I have a 3-year-old and almost 1-year-old, and I took my 3-year-old to the dentist for. We took her when she was, I think, 1 and 2. When she was 2, they were looking at her teeth and they said everything looks good, but just so you know, she's probably going to need braces. These days, every kid ends up needing braces. Is that true? What's going on with that?
Yeah, I disagree that every child needs braces, because the whole point of early functional airway intervention or orthodontics is to avoid braces. But I do agree most kids need intervention. And so I'll explain what that means. So a majority of humans have airway issues now. I've seen stats as high as 90%. I mean, that is astronomical. And so what is happening? If you look back at an ancestral skull, there's a skull right there above me. You will see big, wide jaws, big, wide palate and airway, and we had room for our wisdom teeth. Now, this wasn't that long ago, only 10 or 12,000 years ago, which is a moment blip in time in human evolution. So what has happened so quickly to get our skulls to shrink, our jaws to shrink, and our teeth to become so crowded? You know, we didn't used to have orthodontists. And I recommend anyone, if you're ever at the Natural History Museum and you're looking at ancestral skulls, look how straight and beautiful their teeth are. We're the only species on the planet that has crowded teeth and cavities, aside from domesticated animals. And this is because of our food. So what happened 12,000 years ago? We went from hunter-gatherer to agrarian. Okay, so we went from foraging to now growing mass crops, soy, wheat, eventually corn. And then the Industrial Revolution happened, where we started milling and processing and refining. And so during this time, we went from chewing and masticating a lot, and anthropologists estimate up to 4 hours a day is when we were foraging, how we were chewing, because things were raw for the most part, and we were eating roots and nuts and seeds and things like that. And now we chew, flash forward to 2025, 4 minutes a day, because of the Go-Gurts and the mac and cheese and the chicken nuggets and the Frappuccino and, smushy. And so if you think about when you chew, the forces in your face go out. And this is the same thing that happens when you breastfeed. So the tongue lifts up and it lateralizes, and it's those forces that are over time growing the face wide and the jaws wide. But we've lost that. So form follows function. And we've lost the ability to create proper form and function. And so this is why we have so much crowding. We don't have room for wisdom teeth anymore. Now people, if we wait too long, they don't have room for their premolars. And you hear of people having other adult teeth extracted to have orthodontics when they're 12, 13, or 14 years old. But what else happens when you squish a face? You collapse the sinuses. Okay, so the palate collapses, the sinuses collapse, the septum deviates, and your airway shrinks too. And so this can lead to chronic mouth breathing. And mouth breathing begets mouth breathing. The more you mouth breathe, the more you mouth breathe. And mouth breathing actually changes the way the face and the skull and the jaw grows too. So instead of growing wide, it grows down and long. And I always say, think of Napoleon Dynamite. That's like the perfect example of the facial profile and appearance that's happening more and more now. And so the whole idea is we don't want to wait till a face is almost done growing. And that is often by the age of 10, 80 to 90% of facial development is done. Many people don't realize this. So when you're waiting for all the baby teeth to fall out, baby teeth are usually gone by 12 or 13. That's too late. That's when traditional orthodontists want to put braces on to align all the teeth. But what they're not doing is addressing the underlying issue, which are the jaws. And we have less ability to change and adapt the jaws at 12 or 13 because facial development is nearly done. So this is why we like to see 1, 2, 3-year-olds, and we'll see if there's no space in the baby teeth. We see how the jaws align. Are they already a mouth breather? There's a lot of things we look at to say this child's going to need early intervention. And usually it's retainer therapy. You can start as young as 3. If a child's really struggling, we will do that, like really failure to thrive. If not, we want to start, 4, 5, 6 years old. It just depends on the child and their ability to handle appliances and the family's situation too. But there's a phrase, fix by 6. And that's, to me, this doesn't mean everything needs to be done by 6, but this means we need to start having these conversations and get going, because facial development can be so easily manipulated and adapted while these kids are basically so malleable still. They're growing, they're actively growing, and that's when we want to intervene. And so if you make the jaws bigger and wider, that's a surface area thing. And so now the teeth can come in straight. They have room. Teeth want to be straight. But the problem is the jaws. Our jaws are shrinking. They're too small. And there's a wonderful book, Breath, by James Nestor. If this piques someone's interest, they're like, I want to know more about this. He writes an amazing book all about the why. And I highly recommend it if people want a deeper dive on it. But it's a big issue. And I will tell you, it's very rare in my practice that I see a child where I say, I don't think your child's going to need any intervention. I mean, it is, if I see 40 patients a day, some days between 25 and 40 patients, maybe 5 patients a week, will be the number I see that are doing okay.
There's all these interventional, sorry to
No,
interrupt,
please.
but there's all these things that you're talking about, potentially the retainer, that diet plays a role. I want to talk a little bit more about this. Like, should I have my kids start chomping down on like vegetables, and like, how can I, because it's actually kind of crazy. Not that everything is about aesthetics, but I've actually seen some of these before and after pictures, like before intervention and after. And the person becomes more attractive, which is wild to kind of see that happen, that it can affect the aesthetics of somebody's face. So what can I have my children do,
Yeah, I agree with you. And unfortunately, it's a very delicate line to walk on as a provider, because every parent thinks their child is just beautiful and perfect. And when you bring these things up, you have to do so delicately, because sometimes you don't realize what's awry until it's really explained to you, or until you actually see the after, right? And so when you think of an aesthetic face, I always say Angelina Jolie and Brad Pitt. I know there was controversy there, but they both have beautiful skeletal development. Why? Because they have big, wide jaws. That is key. Big, wide mid faces. That's the aesthetic part. Or Julia Roberts, like her big, wide smile, not that narrow smile. We say there's like black triangles in the side. So that's a big, wide palette. And it does. I mean, I've seen it in my own kids who had these early interventions, and you do see the change, and it's pretty remarkable. It really is. So you're setting them up for success. But things that you can do, unfortunately, we can't unpack 12,000 years of disevolution, if you will, or really epigenetics. However, anything you can do to throw at it will make it just that less severe. So if you can breastfeed, okay, and breastfeed as long as you can, that you're comfortable with. We think ancestrally children probably breastfed till 4 years old. In modern society, that doesn't quite work for everyone, but as long as you can, even the first year or up to 2 years, that will help. But that isn't always an option for everyone, or a desire. And so yes, chewing hard, crunchy foods, carrots and apples and meat, just masticating is important. It may not fix this perfectly. I know so many parents come to me and they see things online, and they're, my child's eating celery and carrots every day. Do you think I can fix this? And it's like, I don't think you can, but it's not hurting. Plus, those foods are healthier. They're cleansing. They create salivation, which is healthy to have. Nice, clean teeth that are washed away by our saliva. It improves digestion to be chewing more. And these foods that we have to chew generally are more nutrient dense too. So there's lots of win-wins in this. But it's certainly not hurting, but very often children still need some intervention. But I am a fan of baby-led weaning. I'm not here to promote any certain way. Everyone needs to do what's right for you. But I think the more we can get our kids back onto whole foods and less of the packaged processed stuff, the better off they're going to be systemically and their oral health too.
And what about kids who are mouth breathing at night? Because, for a lot of adults, we recommend mouth tape and then check for sleep apnea, get a sleep test, all of that. What are the recommendations around kids who have their mouth open at night?
Yeah, we need to determine why. And this is why seeing an airway trained dentist, there's a lot of people speaking of this, but until you're really in the trenches, I will tell you, airway is complicated and it's hard, and it's constantly changing. And I'm evolving my practice constantly, the way I unpack things. But essentially, we're looking, is it a soft tissue issue or is it a hard tissue issue? It's often both. But let me explain that a little bit. So soft tissue would be low muscle tone. Is it just a bad habit, or have we lost strength in our muscles? So we have a lot of facial muscles that work to keep our lips closed. Our tongue is a huge muscle. It needs to be elevated and up at the palate. But if it loses tone, it will lay low. Sometimes kids get sick. They start mouth breathing and then they never get back into the habit of nasal breathing too. So they literally lose muscle tone, just like if you don't go to the gym. It also could be a missed tongue tie, or, different oral restrictions in the mouth, enlarged adenoids, enlarged tonsils. When I do see these things, though, I always want to say, well, why are these things inflamed? Where is the inflammation coming from? We don't just want to go directly to surgery, although many kids do benefit from surgery. I don't want to downplay that, but I still want to know why. Why are they so inflamed? Is it their diet? Do they have undiagnosed allergies or a food sensitivity? Did they have mycotoxin exposure? We also now know, oxidative stress is a huge component in this, and heavy metal exposures and micronutrient deficiencies. So this is where the functional medicine piece comes in. And this is an area, especially the inflammation, oxidative stress, micronutrient deficiencies, I think a lot are missing in the airway space. So that's kind of more systemic, soft tissue, and then hard tissue is what we spoke about, the jaws, the palate, the position of the teeth. And there's also neurosensory issues too. So do they have torticollis? Was the birth fast? Was it challenging? Was the baby under stress? Was there trauma during birth? How is their nervous system integrated? Retained primitive reflexes can be an issue, or just sensory issues. So sometimes we need to see craniosacral therapists, chiropractors to reboot the nervous system and re-regulate ourselves. So it's really, there's a lot of spokes on the wheel for airway. And so it can get very overwhelming to parents. And this is why it is important to find a provider that won't overwhelm you, that will slowly peel back the layers. And this is why we want to start early, because it can take a long time to really unpack and course correct airway issues. You will get there, but there is a certain trajectory that will be more efficient so that you don't burn out from all of these things that we're talking about. But, kids are sick. I mean, I'm not trying to be a Debbie Downer, but our kids are sick and our kids are struggling and they need a lot of help from us right now. And so anything that we can do to clean up the home, get the endocrine disruptors out, get the clean up your kitchen and your cookware and the plastics, and clean up the food, and all the things that anyone listening to this podcast knows about. This is only going to help your child's airway health too, because there's just so much inflammation coming from outside sources in our environment.
Let's talk about adults. I mean, it's so amazing that you have, like you said, fix until 6. You have this like magic time to support kids. But so many of my friends, so many of my family members, even me, like we have all had some kind of airway issue. I didn't even know until Drew was like, you sleep with your mouth open. You should mouth tape. I didn't listen to him for like months. I finally did. I'm like, this is amazing. But what do adults do? I know it's super layered as well, but if someone's like, I do breathe with my mouth, but they're not taking it seriously. So what do they do to fix that in adults?
Yeah. Let me go back to kids real quick too, because you had asked about lip taping. I failed to mention this. So you can lip tape, mouth tape kids, but you want to be cleared first. Okay. So usually 3 and above, you can mouth tape. I truly want it to be used as a Band-Aid as we're unpacking all these things and course correcting. So it's usually for a very short period of time, because all it's doing is just physically keeping our lips closed so we breathe through our nose. Why is nasal breathing so important? We get more oxygen through our nose, up to 20% more oxygen to our brain. How important is that for these developing brains, especially those first 1,000 days, which is the first 3 years of life, but also into adults too? Like oxygenating the brain is important. Getting into deep sleep, that helps with hormone regulation. That's going to help you with, the lymphatic system, the cleansing and detoxifying, and just feel your immune function, just your mood, everything improves. Nitric oxide levels are higher with nasal breathing. Plus your nose warms, it filters the air. There are immune cells in there, so you tend to get sick less. People who breathe through their mouth get sick more. So you can lip tape kids. They make them with it where they're open in the middle. You have to be on board with this. And then the other thing I just want to say, sleep airway issues are on a continuum. So we often just talk about obstructive sleep apnea. That is end stage disease. Okay. We want to catch it way upstream. It first starts with open mouth posture and mouth breathing. And then it can go into sleep disordered breathing, dysregulated breathing. This is another spoke of the wheel I failed to mention, breathing rehabilitation. So many of us aren't breathing properly. We overbreathe, we shallow breathe, we breathe too fast, too rapidly. So sometimes we can get all these things corrected. And then the last piece of the puzzle is physical therapy. They need to be taught, kids and adults, how to breathe again, which seems ridiculous. It's such an innate thing, but it's not. We've lost our ability. So with adults, it's important, again, work with an airway dentist. They may want you to do an at-home sleep study. It does give us a lot of information. But even though I'm the same, my mouth pops open when I sleep. It's a jaw discrepancy issue. It's a muscle tone issue. I've tried to correct it. I'm not going to have jaw surgery. So I lip tape every night and I feel like $1 million when I do. And my sleep scores show that. And if I, for some reason, don't, I'm a disaster the next day. I really notice it. Yeah, you really notice it. And you wake up with a dry mouth. You're more likely to have cavities. So this is one of the first things. If someone keeps coming in with cavities over and over again, but they're eating well and their hygiene's great, I say, I wonder if you're an open mouth breather or your open mouth posture, because it dries out your saliva, right? And it changes the pH. So, but do know with adults, all hope isn't lost. Again, we have to figure out the why. Do you need myofunctional therapy? Do you need physical therapy? Do you need to see a craniosacral chiropractor? Also, do you need orthodontics? And they are doing really cool things that are less invasive than jaw surgery, that can help widen the jaws and create larger airways. And so there are some very, very wonderful dentists and orthodontists doing these things in adults too. So we do tend to take care of our kids first, but please don't neglect yourself. I hear a lot, people will say, well, I'm in my 30s or 40s or even 50s, And I just want to say, but you have another 30, 40, 50, 60 years of life ahead of you. Let's get this fixed now, because it will shorten your lifespan too. Mouth breathing and sleep apnea, it will shorten your lifespan. It puts a lot of stress on the body, and it impacts the microbiome, your hormones, weight gain, metabolic disease, mitochondrial health. It's very important. How we sleep and breathe, in my opinion, is the most important part of health. It's foundational, and then we build from there.
This is such a random question, but have you seen those Jawser-size things?
Yeah.
Is there any legitimacy there? Is it kind of ridiculous, or?
I've tried them. Most of the ones I've tried are way too intense, and they're too wide. So it really can cause more harm than good. This is a joint, your temporomandibular joint, and it's pretty delicate. I mean, we overuse it. This is why I don't like a lot of gum chewing, and this is where grinding and clenching, I mean, it can wear down this cartilage. Think about just like a professional baseball pitcher. They always go on the disabled list eventually. Their shoulder gives out. It's the same with your jaw joints. So I just think it's too much. I think the premise is there, and there are better appliances. There's one I really like called a MyoMunchie. It's just a softer medical grade silicone. It's actually more in a proper occlusion and bite formation, if you will. It's just more functional. And I keep one in my car, and I use it if I'm in traffic because it will strengthen and tone also the muscles. And so that's never a bad thing, right? So anyway, but they are used in children too, MyoMunchies, and they can help with strengthening the muscle and training tongue position as well. But those appliances I know you're speaking of, they're usually marketed to the gym bro crowd.
Really? Yeah.
Yeah.
It's funny. I tried one. I thought the same thing. I was like, this is so intense. And this feels like it's for a maybe 200-pound man's mouth, not mine. But yeah. It was,
or like an elephant or a horse.
Yeah.
I know. I'm not a fan. I think they're too intense. But check out a Myomunchie. Myomunchies are really great.
For sure, we'll check that out. So let's talk about, fluoride is being heavily discussed right now. What are your thoughts on fluoride, and do you ever use it in your practice? If there's anyone who's listening whose dentist still recommends it, what are your thoughts?
Yes, it has become very politicized. So many of us have been speaking about this for a very long time before it became so political. Um, I like to start this story this way, just so everyone knows. I was traditionally trained, and I used to be a huge fluoride advocate. I used to prescribe it to patients. I used to tell everyone they needed it. And I'm in Portland, Oregon, where the water is not fluoridated. And it was back on ballot in 2012. And I volunteered for the pro water fluoridation team for a while. And what changed and here's the thing, I never questioned it. I blindly accepted this as truth. All my professors, all my faculty, you're just thrown this information over and over and over again. And it's really dogma, but you accept it. And I'd say most people do, until you don't. And I sat in a debate during this ballot measure, and it was the first time I listened to the opposing side, those with concerns. And I used to think they were the tin hat brigade, and they were pseudoscientists, and they were public health, they were just trying to dismantle public health, and how dare they? And I listened, and my mouth was agape to the floor, because number one, they were so articulate. These were scientists. These weren't always dentists. These were epidemiologists, neuroscientists, biochemists, microbiome experts, researchers, dental materials, chemists, and they were coming out opposed to it because of all the data on fluoride and its neurotoxicity. And it is defined as a neurotoxin. And so the controversy people will say is dose makes the poison. Okay. And that's what I get when I speak of this. This is the pushback I get. And this is true. I agree with this. But let's unpack water fluoridation specifically. So number one, my issue with water fluoridation, it's a medical consent issue. We are mass medicating a population without their consent. And we're treating everyone the same. So my decay risk is low. I haven't had a cavity since childhood, but I will get treated the same as someone with rampant decay in their mouth. Okay. And I'm expected, if I don't want this in my water, because I'm concerned, that I have to buy a reverse osmosis water filter, which is extremely expensive, or I'm supposed to drink bottled water, which, by the way, many bottled waters have fluoride in them. Now I'm exposed to microplastics, plus there's an environmental component to this, plus an expense. So it's just a medical consent issue. And we should not be administering drugs, and fluoride is considered a drug, to the populace without consent. My second issue with water fluoridation, there was a trial. It was a federal trial, the TASCA trial. And perhaps people heard the ruling did come in. It took 7 years. The ruling came in last year. The judge said there is an unreasonable risk to current water fluoridation practices because of concerns with neurotoxicity, especially when women are pregnant and infants and young children. The neurotoxicity concerns are on par with lead. So IQ drops in children on par with lead. And he said the EPA, you need to regulate this better. And it's in the hands of the EPA. The EPA is appealing. They're reviewing the science, which seems insane to many of us because there's so much data and science, and the burden of proof should be on safety. But for some reason, water fluoridation gets a hall pass, and we're trying to prove without a doubt that it's unsafe, which is just backwards to how we're supposed to be treating pharmaceuticals and drugs. So that trial happened. There was a National Toxicology Program report that came out that said, at certain levels of water fluoridation, there are concerns of neurotoxicity. This includes at current practice levels, which is 0.7 milligrams per liter. People push back on this. A lot of the data says at 1.5 milligrams per liter, that's where there's an issue. We fluoridate at 0.7 milligrams per liter. So people will say, see, it's perfectly safe. That's a very narrow window of safety and margin there. I will tell you, it's very difficult to titrate water, the fluoride in the water. Ask your water bureau what your actual fluoride levels are. I've seen them as high as 2.1 milligrams per liter. So just because on paper it says we're supposed to be fluoridating at this certain level, many municipalities are far above that. But this is what we're missing in this dose makes the poison conversation. It's the halo effect. So you might drink a liter of water a day, and I might drink 3 liters of water a day. Okay, that's a very different fluoride exposure for me. Plus, I might eat a lot of ultra-processed foods. If I'm eating a lot of canned soup, Gatorade, anything with water in it, these factories are not using reverse osmosis to filter their water. And over 70% of the United States is fluoridated. So you very likely have fluoride in your food. You are also exposed to it in toothpaste and rinses and varnishes at the dentist. And one of the top exposures of fluoride is pharmaceuticals. So SSRIs, Prilosec, you guys can search it. Search all the drugs that have fluoride in them, your prescription drug. So how are we titrating and calculating exactly how much is exposed to? And then on top of that is body size and weight and composition and detoxification pathways. The EPA expert under oath during that TSCA trial was asked, what is the margin of safety according to the EPA with water fluoridation? And his answer was 10x. And why do we need a margin of safety? This is to protect vulnerable populations. Vulnerable populations are pregnant women, infants, and children. Now think about, many infants are on formula, so that formula is getting mixed with fluoridated water. Plus, there can be fluoride in the actual formula too, okay? So infants, children, people with kidney disease, people with calcium deficiencies, iodine deficiencies, genetic polymorphisms. We are not screening the population for this at all, and we're nowhere near 10x. So many of the experts will agree that at 1.5 milligrams per liter, that's where we can see neurotoxic issues, okay? We are fluoridating at 0.7 milligrams per liter. So if you believe 1.5 milligrams per liter is where it starts to get a little dangerous, what would a 10x margin be? 0.15 milligrams per liter. Okay, and so we are fluoridating about 5 times the amount of this EPA directed safety window. So that just means we should be lowering the dose of fluoride in the water to protect these vulnerable populations. Let's say we went ahead and did that. Let's say the EPA is like, okay, we're just going to drop it. Now it's not even there's no efficacy, and there's not even efficacy currently. So this is the other part to add. You're going to hear on the media that water fluoridation reduces cavities by 25%. That is based on old data. They're cherry picking what studies they share with you. They like that stat. That stat's old. That's from an old Cochrane Collaborative report from 2011 and 2015. Okay. A new Cochrane Collaborative report came out. Now, this is considered the gold standard for science and safety recommendations. It's basically like these big meta-analyses where they look at all the studies and the research. A new Cochrane report came out last year, 2024, and it showed that water fluoridation is only reducing cavities by about 3%, 1/4 cavity per person, 1/4 cavity. And when they ran their stats, this is not statistically significant. So it's not even working as we fluoridate now. So to me, there's just so many boxes checked of this is antiquated. The risk versus benefit ratio isn't there. We know fluoride works topically, not systemically. This has been proven in the data and the science. They actually teach us in dental schools, okay? So why are we ingesting it? That's the whole thing. We don't need to be swallowing it. If we want to be using fluoride to protect our teeth, it needs to be applied topically. So in a toothpaste, rinses, the varnishes at the office. The other thing that is never discussed, although Drew interviewed Marty, and Marty was the first person I heard publicly say this, and I fell in love with him that day. He said, it can impact the gut microbiome. So fluoride is antimicrobial. It's not selective. So it's killing healthy bacteria too. If you're swallowing this every time you drink water or are exposed to it, what is it doing to the gut microbiome? And there's a lot of data to say not good stuff. It is creating a diversity issue and wiping out our commensal healthy bacteria. I could go on and on. So from a topical fluoride standpoint, I say personal choice. I do not use it because I just want to minimize my toxic burden every day. It is a neurotoxin. I don't need it. I'm eating well. I believe in hydroxyapatite. Hydroxyapatite is a fluoride alternative. Hydroxyapatite is actually what is in your teeth. Your enamel is made of hydroxyapatite. Your bone is made of hydroxyapatite. It's essentially calcium and phosphorus. Hydroxyapatite's been around for 50 years. It's been used. It's approved by the health ministry in Japan and South Korea. The SCCS, the Scientific Committee of Consumer Safety, has approved it in the EU. And it's biomimetic. So it's important to note no one has fluoride deficiency. That's just not a thing. We don't even have fluoride in our body or in our teeth, but we do have hydroxyapatite. So I'm a believer in like supports like. So I use hydroxyapatite, but if people want to use fluoride toothpaste, I just suggest make sure you're spitting. I do not like it in kids before they're spitting. So I would use an alternative, but the data shows that hydroxyapatite performs just as well as fluoride, and you don't have the neurotoxicity concerns, and you don't have the microbiome concerns. And that's a part of the conversation I don't hear many people speaking about.
Well, we use your toothpaste Fig, and I remember, I don't even know when we started. We might have been like the earliest users. And I remember being like, Drew, like, is it actually washing my teeth? Because you're not used to it. So if you're going from like fluoride toothpaste to, the ingredient that you mentioned, like it's different, but I haven't had issues years later. So I just share that if anyone's like, I don't know, are these things cleaning my teeth? It is. It's just something you got to get used to.
And the thing with our product too, we wanted it to be oral microbiome supportive. That was the whole premise and mission of our product. It wasn't necessarily hydroxyapatite. That was important. But we removed all the emulsifiers and surfactants, and essential oils. So think about most traditional toothpaste. It foams a lot, right? And it burns. And some people love that burn and that mintiness. Essential oils will kill healthy bacteria too if overused. So just think, just as I mentioned earlier, if you need that burning and that strong mint because you think your breath is so bad, I think you might have something else going on. You're just trying to mask this issue. It does take some getting used to because we're used to that. I say it's just like many of us, we transitioned away from foaming shampoos or washing our hair as much. Or like our deodorant. Okay, we all went through that time where it was like, whoa, okay, I'm committed, but this is intense. It's the same with toothpaste. So it's just, and your microbiome will adjust, but it takes time. You just have to understand you're boosting your microbiome. It's coming back to how it was supposed to be. And so I want people, when they're using oral healthcare products, to read ingredients, just like we read food ingredients. What are all these things in my toothpaste? I mean, you're putting it in your mouth. And what happens in the mouth doesn't stay in the mouth. It's absorbed through the mucosa. You are swallowing trace amounts of it. Certainly your kids are swallowing it. So you do want to try to have it as clean as possible.
And I just started using Feed Your Good Guys, right? Is that
Yes,
the Fig?
right.
Yes.
Fig.
Yes.
Yep.
I just started using it too. And I definitely had that adjustment period at first where I was like, okay, but wait, what if my breath is bad? And then all of a sudden, after like 2 weeks, I almost felt as if the microbiome was changing in my mouth, where I was like, I actually don't feel like I have bad breath at all. Like, and I'm totally, I got adjusted to it. And I appreciated that I could look at the bottle and read every single ingredient. And I was like, I know this, I know this, I know this. Oh, there's matcha in here. That's amazing. Like, it was nice to see all these ingredients that you can recognize. And now my daughter uses it too.
Oh,
And
good.
it's,
Thank
yeah,
you.
yes. We love it. And, I also appreciate that when you were talking about fluoride, you essentially said, I changed my mind based on new information. And I think that that's so rare sometimes in the medical community. You see it a little bit more, and especially with the people that we talk to, but sometimes things get grandfathered in and it's like, no, I'm sticking to this thing, even though there haven't been updated studies or updated information. and people are maybe prideful or whatever it is, and they don't want to accept that, hey, maybe I had it wrong all those years and now I have to do the right thing for my patients, right? Because that's who you're looking out for first and foremost. So I appreciate you sharing that story.
Thank you. Do no harm. I actually just listened to a debate at a local community near me, and a couple of the pro water fluoridationists, they both said to the city council, I don't care how much information comes out against fluoride, I'm never going to believe it. They said that. I mean, so, and that's the vibe. It doesn't matter. The Cochrane report, they'll say, we don't trust that. We trust the old Cochrane report from a decade ago, but this new one, no. Or these meta-analyses or the National Toxicology Program, they just, it's wild to me. It's wild. And honestly, a bigger issue for me is the challenge on science and the scientific method. I mean, if we become so indoctrinated with these ideas that we can't look past them when new science emerges, that's scary. I mean, that's really a scary thing. But I do think there will be a shift. I wish the politics hasn't infiltrated as much, because now it's just getting diluted, I think, and we're losing the message. But I do think there are people kind of awakening, if you will, and they are listening. And you know, with AI, people have access to all kinds of information now very easily, for better or for worse, although you can't believe everything you read. But I think in the younger generation of dentists too, I think are very much questioning traditional dentistry and some of the things that we've been taught. So I'm pretty hopeful about it.
Well, for anybody who's listening, we know that they got to find the right person to work with. There might be interventions they need to take, but let's talk about some things they can do at home. What does an ideal oral care health routine look like?
Yeah, great question. We like protocols, right? So I just always like to say, what do I do? And this may not work for everyone. And I think it's important to know what works for me may not work for you. My toothpaste works great on my family and myself and a majority of my patients, but there's going to be some people they don't like it. It doesn't work for them. You know, it's the same with anything. So this is my protocol though. I oil pull a few days a week. I don't do it every day. I use a raw organic coconut oil. So oil pulling is an ancient Ayurvedic practice. It feels good. Your teeth feel smoother and cleaner, but it is disrupting the biofilm too, which is the bacteria in your mouth.
What are you doing? Like swishing it? I should know this, but I don't. So you're just swishing it in your mouth.
You
Okay.
take a scoop and you put it in your mouth and it will melt. And some people, they can't do that, but it melts and then you just swish it. And I do it in the morning as I'm like cleaning up my bedroom and laying out my outfit for the day. I recommend you don't spit it down the drain, because it can recongeal and potentially clog your drain. So spit it into, a little trash can or bag. The reason I say don't do it every day, there's something in coconut oil, lauric acid, and it's antimicrobial. It's very mildly antimicrobial, but again, we want to nourish and support our bacteria, including the good ones. So I don't like to do it every day. So I'll do that a few days a week. Then I floss and brush in the morning. Now, people always ask, do I brush before I eat breakfast or after I eat breakfast? If I'm going to be a purist, you should ideally brush 20 or 30 minutes after you eat breakfast. And why do I give that time span? Every time we eat, our mouth becomes acidic, and that acidity can pull out some superficial minerals in your enamel and make your enamel a little weak. So if you were to then go with the bristles of your toothbrush, you can be wearing away healthy enamel and it just won't come back again. This is the same after you vomit. And this is hard. People want to brush their teeth right after, but my suggestion is try not to. Maybe just rinse with baking soda and water, but try not to brush right away. Just wait a little bit, just so you're not flaking away your enamel, okay? Because your saliva over time, 20, 30 minutes plus, if it's healthy, it will naturally remineralize and naturally harden that enamel again. That's why your saliva is so important. But I do floss and brush in the morning. I am an overachiever with flossing. I want people just flossing once a day, ideally. And if you're going to pick, I do nighttime. Okay. But I'm just sharing what I do. And that's it. That's what I do in the morning. And then I will sometimes floss and brush at lunch at work. You know, I'm working with the public, so factor that in. If you can't do that, maybe just grab a piece of xylitol gum or just really rinse with some water after lunch. A strategy too, if your kids are eating crackers or chips or granola bars or pretzels, those are high cavity causing foods, believe it or not. Flour acts like sugar in the mouth. So I like to try to reduce or eliminate those, but that's not always realistic. So you can stage food, and this includes for adults. So if you eat crackers or chips or something, eat your apple or carrots after, because that crunchiness will dislodge the food and increase salivation and kind of rinse away food particles. Rinse with water. And then at night, I floss and brush. Oh, I left out too. I like to tongue scrape, and I usually do that at night. So I'll tongue scrape, floss, and brush. And then because I am getting a little older, I like to alternate traditional floss with a water pick. Now, why do I say that as we age? As we age, we all do lose a little bit of bone around our teeth. Hopefully not too much, but traditional flossing, it's going to scrape the sides of your teeth. So it's going to remove the bacteria and biofilm. But then there's like this little pocket, you know, that the floss won't get. So if you can just blast it with a little spray of water, it will make your mouth feel a lot cleaner. And once you start, people love it. So it's one extra step, but for these people who are really into protocols and optimization, that's what I'd recommend. And I floss one night, I water pick the next. I floss one night, I water pick the next. So, and I do tongue scrape too, and I'll do that first. So what tongue scraping is doing, it's removing the biofilm from your tongue and any food remnants. So actually it will improve your taste buds and your ability to taste food. But also a lot of pathogenic bacteria love to hide on the very surface of your tongue. The healthy bacteria that create nitric oxide, they love to live deep in the crypts of the tongue. So we want to protect those. So you don't want to scrape too hard, but this is another ancient Ayurvedic practice. And it's one of those things too, don't knock it till you try it. Most people, when they start tongue scraping, they just can't not do it. Plus it's stimulating lymphatic drainage and just musculature in the tongue too. So that's my routine.
Do you have to clean the mouth scraper? I'm sure you even know, Kate. Like, what do you do after you do it? I'm trying to get into it. Drew has been telling me, and I'm like, what do I do afterwards? Like,
I just rinse it with water, honestly.
Okay.
So most oral bacteria cannot stay viable outside of the mouth for very long at all.
Oh, interesting.
Viruses are different. So if you're sick with a virus like the flu or COVID, you want to throw away, I would say, everything. Because viruses can stay, vital for 7 to 10, 14 days on surfaces. But oral bacteria, they're very particular. They want a certain temperature and moisture range and humidity range. And so if they're outside of that environment, it's why it's really hard to do studies and research on them too. But you could, if it grosses you out, I'd say just soap and water is fine. Yeah.
And
now that I know they don't live.
If it's not virus, if you're not sick, how often should people be changing their products out?
Good question. So most will say change your toothbrush every 3 months, but I think that's too long. So once your bristles start to splay and fray, you really should change it because again, it can wear away that enamel on your teeth. So that just depends on your technique. I mean, some people really are too aggressive with how hard they brush their teeth. So that's another thing. Please lighten up your touch. Like think Bob Ross painting, like very paintbrush, so gentle. You don't need to be scrubbing.
I feel like it's like men. All the men just.
I'm a man.
I know.
Like, what are you doing?
I look at my husbands and mine, and I'm like, what were you doing?
I feel like they're taking out their frustration at night or something. Like get a punching bag or something. You need to go unload in other ways. So some people I think need to change it every month. It just depends. So just keep an eye on your bristles. They should not be looking haggard, if you will, because that can be damaging your enamel.
Finally, if anybody wants to learn about you, your brand, where can they go? Tell us a little bit more about that.
Thank you. Yeah. So I have a website, drstaci.com, and I have a newsletter, a weekly newsletter where I really try to unpack a topic in depth every week. I love social media, and I'll say my account in a moment, but it's so just a burst of information. It's like always such a teaser. And so I really like deep dives on education. That's why I can talk forever on these podcasts. So check out my newsletter, and I do online consultations too for 13 and under, so for kids. So if there's no one like me near you, I'm always happy to help and give a second opinion or help guide you or health coach you. And then I am on Instagram, Dr._Staci. I show up on TikTok and X a little bit, but Instagram's mostly where I hang out.
Amazing. We love your Instagram. We're huge fans. And like we mentioned, we love Fig, your brand. So thank you so much for joining us. This is a topic we don't get to discuss as much, but I know it's so important. So thank you.